Hello, I'm Tu Kim Lam. Welcome to the Medical News Show from Washington, D.C. In this edition of the Medical News, we'll talk about the chronic obstructive pulmonary disease, or COPD, and the newest medication for COPD. According to the U.S. Centers for Disease Control and Prevention, COPD is the fourth leading cause of death in the U.S. and in the world. What is COPD? Why most cases when patients discover the disease, they were already in serious condition? Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will help us to answer some of the questions about COPD and the latest medication today. Welcome to our Medical News Show, Dr. Tran.
Yes, welcome to our Medical Show's news, and hello, Mrs. Lam.
Hello, sir. Today we're going to talk about COPD, or the chronic obstructive pulmonary disease. So the information on this disease is still very limited in our Vietnamese community. Before we go into detail, would you please explain to our audience what is COPD?
Well, COPD stands for chronic obstructive pulmonary disease, pulmonary related to lungs. So these are two main forms of this disease. The first one called chronic bronchitis. This means chronic disease related to the small airways. The second one is called emphysema, causing by the damages of the alveoli, the basically unit of the lungs. But most people may have the combination of the two. This means they have chronic bronchitis and also have emphysema.
So to help our audience have a better understanding of the COPD disease, would you please describe briefly about the structure of the lung?
If you look at the screen, you can see the lungs look like have two big balloons at both sides of the lung. Right in the middle is the heart. But if you look the inside of the lung, you can see the whole airway. It looks like branches of the tree. And these are the broncho airways, because when people they inhale, the air will go to these and leading to the small balloon called alveoli. The alveoli is composed of so many small balloons. The function of these alveoli is the place where all the exchanging of the oxygen and carbon dioxide were exchanging with the blood flow go to the lungs. So therefore, when we inhale, we get the oxygen in and trans to exchange with the carbon dioxide when the person exhale, to exhale all the toxic gases outside. So these are the main functions of the lungs. If you look at the basic unit of the lungs called alveoli, you can see all the disease related to that, like on the screen you can see right in the middles. In the middles is normal alveoli. On the right side is abnormal because collapse causing by emphysema, and the left side you can see causing by pneumonia, and the alveoli seem to be more condensed, a little bit more distended. So these are the basic understanding about all the disease of the lungs.
So COPD has caused a lot of dangerous damages to our health. And you mentioned earlier the two main damages was how can the patient or the doctor recognize which are the between two of these forms?
Basically, to differentiate two forms is chronic bronchitis and emphysema, usually based on the evidence that we found, because most people, they don't know whether they have chronic bronchitis or emphysema. But if you look at the pictures of the people with chronic bronchitis, you can see on the screen, on the left side is normal airways. It's very patent and open completely. Now on the right side, the airway becomes very thickened, and there's some mucus, what we call phlegm or sputum inside, causing obstruction. So this is the pictures of the chronic bronchitis. Now, you look at the second pictures of emphysema, you can see the whole upper side of the lung in the left side were collapsed because all the alveoli were damaged and it cannot function anymore. It's no exchanging an oxygen or carbon dioxide in these airways anymore. So this is different with chronic bronchitis. So I think that's the basic understanding to differentiate between the chronic bronchitis and the emphysema.
So can you tell us at what age a person usually have COPD, and what are the risk factors that leading to COPD?
The age most commonly is about the middle age, because based on the histories of smoker or exposure to fumes and gases. People who smoke one pack a day maybe take about 15 to 20 years to develop some form of chronic bronchitis. But not everybody is really a smoker to have a problem. And we found that the people really lack of the enzyme called alpha antitrypsin may develop emphysema at early age as well, because they don't have the enzyme to protect the lung from damage caused by leukocyte. Leukocyte is like soldiers in the body. They try to get to the lung to kill all the bacteria or get rid of the infection in the lung. When they do that, they release the chemicals called protease. Protease can kill bacteria, causing problem, but it's also causing damage to the alveoli as well. Therefore, the body only have the enzyme called alpha antitrypsin to protect the lung from damages. So people really have problem running family, hereditary, then they don't have enough the enzyme to protect the body, so they will develop emphysema. Now, thirdly, people may expose to a lot of pollutions, air pollutions and gases at work or in the air in the big city with a lot of pollutions. But lastly, it's very important to remember, like in Vietnam, people using wood for cooking most of the time, and no ventilation in the kitchens. Therefore, most of the ladies in Vietnam, I remember, they may expose to a lot of fumes and gases in the house and may develop COPD later age. Now, in the United States, in the small town or in the poor area, people use the wood in the fireplace to keep warm during the winter. That's making or causing also problem as well.
So according to CDC, that this is another silent killer, and also is a fourth leading cause of death for many people. The disease might have taken up to 30 years to develop. Can you tell us what are the signs or symptoms that a person, if they suspected they have the disease?
The most common symptoms related to COPD is coughs, because the problem with cough is because most of the disease in the lung is causing cough, and people smoke really pay attention much on cough because they cough most every day early in the morning because they blame it for smoking. But later they may feel like they get short-winded. I mean, they get short breath when they do like minimal activities, walking around or carry a little thing. They may feel like they don't get enough air. And more than that, when things are getting worse, they have more mucus and they get wheezing at night. They couldn't sleep because the lung have a lot of sound and musical sound inside called wheezing. So these are the symptoms related to COPD. But these symptoms could be related to asthma as well, or could be the wheezing related to the people with the heart failure as well. So therefore, we cannot use a symptom to make the diagnosis of COPD. We have to rely on further testing to make the diagnosis of COPD.
So can you tell us what kind of diagnoses are made of to detect COPD, and are these tests expensive?
If you look at the testing for COPD, I think it's not very expensive. It's very commonly used. The first test we use is called pulmonary function test, or spirometry. Is a little machine, and we just ask people to really inhale and blow quickly into the machine so the machine can measure how fast the flow of the air and to measure how the obstruction look like inside the lung. It's very simple. It doesn't cost much. Can do everything in the office as well. If that the case, then the second one we use chest X-ray, the regular one we use for almost 50 years. And mostly with the expert eye, they can recognize the COPD. If you look at the pictures on the screen, you can see the first one is X-ray of regular normal people. It's quite clear. The air on both sides, and the middle is the heart. But then the next one, you can see COPD, a lot of air trapped inside. The lung quite to be distended. It's darker because so much air inside. So these are the classical pictures of the COPD on the regular X-ray. But now with new technology, with the CAT scan, you can see how clear. Look at the normal CAT scan. The CAT scan means they cut the chest into a slide, to a very thin slide, and look at the inside of the lung. You can see both sides, the air on both sides, right in the middle, in the heart. And then look at the next one, you can see most of people with COPD, they have a tiny little hole inside. So these are the testing we use, pulmonary function test, and if we have a little bit more financial support, we can get some CAT scan to get the clear picture of COPD.
So if a patient that left the disease untreated for a long period of time, what are the complications, and which one is the most dangerous one?
Complication is really multiples. I think it's first one we have frequent infections, and the worst case is pneumonia. People may die from pneumonia as well. Secondly, people may develop respiratory failure because when the all airways are obstructed, become narrow, because people may depend very much on the oxygen to supply with the oxygen for them. And you can see many people carry the oxygen tank with them when they're moving around. And thirdly, I think it's collapse of the lung, when there's tiny ruptures of the lung causing by emphysema. The whole lung may be collapsed or half the lung collapse. Therefore, they need the surgical intervention right away to save the lung and to really expand the lungs again. And fourth is very important, very dangerous one is cancer of the lung, because mostly related to the chronic smoker, smoking cigarettes as well. So these are very important things to remember, because there's a lot of complications related to this disease.
Sir, let's talk about the treatments. Would you please tell us how many kind of treatment are currently using?
Well, for so many years, we try everything to save lives and to help people with COPD. We use the antibiotic to prevent pneumonia. We use the medication they call bronchodilators, either inhale or using a little machine to get the medicine inside the airways to open up the airways for them to breathe. But these medications have short acting. They last only either a couple of hours or maximum is about 12 hours. So they have to keep using these medications. And thirdly, we use the medication, bronchodilator medicine, and using prednisone for so many years to decrease the inflammations inside the airways. But these medications we cannot use long term because they may have other side effects as well. And then we can therapy, help people to really do the exercise and respiratory exercising to improve the lung capacity as well. But the good news is lately we have the new medication just come out in March of this year.
This medication, and what are the side effects that would have?
The new medication have the name is daily resp. That means to improve the respirations. Mainly this medication a little bit different from all the medication we used before. It's not bronchodilator. That means cannot use during acute short breath, but we have to use every day in order to decrease the inflammation or swelling inside the airway, to improve slowly the airways long term. And the studies show that they prevent a lot of flare-up or exacerbation of the symptom of COPD. So therefore, we hope that with new medication, the FDA already approved in Canada as well. So hopefully Hopefully, we have more medication or new tools to help people with COPD. It's very difficult to treat because the lung already damaged, and the only thing we have to do is to preserve and prevent from all the complications down the road. So this medication is the new hope for people with COPD, but it's not perfect because still have some side effects. And really, people with liver problem like moderate or severe disease of liver may not able to use this medication.
So before we go, would you give our audience some advice on how to prevent the COPD?
How to prevent very important, the quit smoking. And then I think that's the best way we have to deal with that. Avoid any air pollutions and to improve ventilation in the working condition that is exposed to a lot of fumes and gases. Especially at home, try not to use wood for fireplaces or cooking and things like that. But beside that, I think the vaccine, pneumonia vaccine, is very important because it's simple. It's not very expensive. It's one shot every 5 years. Most people, regular people, or people with COPD or asthma may get the pneumonia vaccine. Is very important. So quit smoking, pneumonia, and avoid pollution. I think hopefully we can prevent most of the disease related to COPD.
Thank you, Dr. Tran. That is all the time we have for today. Thank you for joining us.
Thank you for watching our shows, and again, thank you, Ms. Lam.
Thank you, sir. That was Dr. Sang Tran, who just shared with us the information on the COPD, or the chronic obstructive pulmonary disease, and its newest medication. We hope that the information provided by Dr. Tran has shed more light on the disease. That is all the time we have for this edition of the Medical News. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News. Until then, have a great one.